My name is Amanda Sepian, and this is my presentation on Ondansetron. Ondansetron is a 5-HT3 antagonist used in the prevention of nausea and vomiting in chemotherapy and radiation therapy, and the prevention and treatment of postoperative nausea and vomiting. It is classified as an antiemetic, and all antiemetic drugs help to control nausea and vomiting induced by various causes, like I stated above. The generic name is Ondansetron. Brand names include Zofran, Zofran ODT, and Zuplenz. Ondansetron is a selective serotonin 5-HT3 receptor antagonist. Serotonin is a neurotransmitter that may cause nausea and vomiting when present in the stomach. So this works by blocking the action of serotonin 5-HT3 receptor sites. The receptor sites are present on vagal nerve terminals in certain areas of the brain, and these antagonists bind to those receptor sites to suppress vomiting and nausea. The binding of these antagonists inhibit serotonin from eliciting its effects. And the chart to the right just provides more of a visual aid for you to look at. The dose and route depends on the reason for taking the medication, but Ondansetron can be given orally, IV, or intramuscular. It is mostly given oral or IV. For the prevention of nausea and vomiting associated with chemotherapy, the dosage depends on the route and who is receiving the medication, whether it be an adult or a child. I will point out that Ondansetron is administered 30 minutes prior to chemotherapy, both orally and IV. Adults can take 8 milligrams before chemotherapy and then another dose 8 hours later. The dose may be given every 12 hours for 1 to 2 days if symptoms persist post-chemotherapy. Children receive half the dosage before therapy, and it is repeated 4 and 8 hours after. IV infusion is 0.15 milligrams per kilogram before therapy, with repeating doses 4 and 8 hours after the first. The maximum single dose is 16 milligrams through IV. And for patients experiencing intensive chemotherapy, they can get a higher dose of 24 milligrams orally 30 minutes prior to chemotherapy. So for the prevention of postoperative nausea and vomiting, the dosage again depends on the route. So orally PO, 16 milligram tablets are given 1 hour before administration of anesthesia, and through IV and IM, adults can get 4 milligrams before anesthesia or postoperatively. Children who are greater than 40 kilograms can receive 4 milligrams, and less than 40 kilograms can only receive 0.1 milligram per kilogram. The pharmacokinetics of Ondansetron, the IV administration results in complete bioavailability, and 100% is absorbed following oral administration. It is extensively metabolized by the liver, and about 5% are excreted unchanged by the kidneys. It has a half-life in adults of 3.5 to 5.5 hours, and children in 2.9 hours. So the route, PO or an IV, has a very rapid onset. Its peak is about 15 to 30 minutes and lasts for 48 hours. IM also has very rapid onset with a peak after 40 minutes, and the duration is unknown. The dose may need to be adjusted in patients with severe hepatic impairment. The route, no matter what, is to not exceed 8 milligrams a day. However, no dosage adjustment is needed in patients with mild or moderate hepatic disease, so it's only with those with severe hepatic impairment that need dosage adjustments. Let's move on to drug and food interactions. So drug-to-drug interactions. Apomorphine and Ondansetron used together increase the risk of severe hypotension and loss of consciousness. Serotonergic drugs, which include SSRIs, antidepressants, fentanyl, tramadol, I listed a couple more, increase the risk of developing serotonin syndrome, which I'll talk about. Carbamazepine, phenytoin, and rifampin may also decrease the effects of Ondansetron when taken together. As for food, there's really no specific food interactions or things to avoid. Grapefruit juice, like with other medications, often prevents the intestines from processing ondansetron and other SSRI medications, which can lead to increased levels of serotonin that can result in serotonin syndrome, which I will talk about. Common side effects include headaches, diarrhea, dizziness, and fatigue. These side effects are all pretty mild. Moving on to more of the rare side effects include serotonin syndrome, Stevens-Johnson syndrome, and Zofran has the potential to cause arrhythmia in the QT interval of an electrocardiogram. So like I said, these symptoms are more rare, but serotonin syndrome occurs when you take medications that cause high levels of the chemical serotonin to accumulate in your body, so you have an excess of serotonin. Stevens-Johnson syndrome is where you develop rash all over the body, especially around your mucous membranes. So some important nursing considerations to consider before administration of ondansetron include assessing the patient for nausea, vomiting, abdominal distension, and bowel sounds prior to and following administration each time. You want to monitor for signs and symptoms of serotonin syndrome, which include mental status changes, agitation, hallucinations, dizziness, diaphoresis, neuromuscular symptoms, and also probably want to monitor their vital signs. Assess for rash periodically during therapy, as rash could signal Stevens-Johnson syndrome. And monitor their EKG, as this drug can cause arrhythmia in the QT interval. Alright, so we're just going to do an NCLEX review question. Which drug works by blocking serotonin in the GI tract, vomiting center, and chemoreceptor trigger zone? A. Metoclopramide, commonly known as Reglan, meclizine, droperidol, or ondansetron? The answer is D, ondansetron. And the rationale is ondansetron is a serotonin blocker, metoclopramide is a prokinetic drug, meclizine is an antihistamine, and droperidol is an antidopaminergic drug. And these are just my resources, and I hope you enjoyed the presentation.